My name is Jordan Herring, and I'm doing my speech on cardiopulmonary resuscitation, or CPR. The American Heart Association released that nearly 383,000 non-hospital cardiac arrests occur annually, and that these are the most common cause of death. Knowing CPR could be the difference between life and death for so many people, and could significantly reduce the mortality rate. Today, I'm going to explain exactly what CPR is, the importance of it, and the benefits in knowing it. CPR, also known as cardiopulmonary resuscitation, according to the British Heart Foundation, is a life-saving medical procedure which is given to someone who is in cardiac arrest. It helps pump blood around the person's body when their heart can't. When the heart stops, the lack of oxygenated blood can cause brain damage in only a few minutes. A person may die between 8 and 10 minutes. CPR, or knowing CPR, can keep oxygenated blood flowing to the brain, as well as other vital organs, until an individual can receive the medical treatment needed. Here is just the steps of CPR. The American Heart Association uses the letters C, A, B in that order to help people remember the steps: compressions, airway, and breathing. Starting with compressions, you place the heel of your hand over the center of the individual's chest. Using your full body weight, you push straight down hard at a rate of 100 to 120 compressions a minute. If you're not trained in CPR, you're supposed to continue those compressions until that individual receives medical personnel that they need. If you are trained, we move on to step 2, which is the airway. If you're trained in CPR, after 30 compressions, you're supposed to open the person's airway. You put the palm on the person's forehead, and you gently tilt their head back, lifting their chin forward and opening their airway. Then you move on to the third step, breathing. Pinch the nostrils shut, and you do mouth-to-mouth, covering the nostrils, making a seal. Prepare 2 rescue breaths. If the chest rises after the first, go ahead and give the second breath. If it doesn't rise, you repeat the head tilt, chin lift maneuver, and then give the second breath. And resume chest compressions to restore circulation until medical personnel arrives. Why is CPR so important? Approximately 95% of sudden cardiac arrest victims die before reaching the hospital, according to the International Journal of Current Research. If no CPR or defibrillation occurs, brain death starts to occur 4 to 6 minutes after someone starts experiencing cardiac arrest. A bystander who is trained in CPR and that begins immediately performing on an individual after cardiac arrest can double the victim's chances of survival. The International Journal of Current Research claims that a bystander can play a significant role in the positive outcomes following a cardiac arrest situation, increasing the 30-day survival rate from 4% for patients who did not receive any CPR before EMS arrives to 10.5% for those who received CPR prior to EMS arrival. CPR, or cardiopulmonary resuscitation, is an emergency life-saving course of action taken where an individual's breathing or heartbeat has stopped. This procedure is a combination of rescue breathing and chest compressions. This will keep oxygenated blood circulating until a heartbeat or breathing can be restored. Not performing or not knowing how to perform this and waiting too long can lead to permanent brain damage or even death for most people. This is so important to help increase the rate of survival for those who experience cardiac arrest. It is easy to learn, and there are so many options that a person can take to make sure they are certified and know more about CPR. And I encourage each and every one of you to go out and get certified today. And these are my sources.